Receives a cancer diagnosis, they often want to know about the course of treatment. Robotic surgery is becoming more popular as a form of treatment. Here to discuss how it works is Dr. Iman Siddiqui, surgical oncologist with the Hartford HealthCare Cancer Institute in North Haven and New Britain. Doctor, welcome.
Thank you, Lisa.
Great to have you. So how do you determine if someone is a candidate for surgery versus other forms of cancer treatment?
Well, when somebody gets diagnosed with cancer, obviously it's devastating news for that person. But we go through a series of steps to help determine the stage. And first of all, patients will end up getting CAT scans. Sometimes they get MRIs. And specifically for cancers involving the gastrointestinal tract, which I specialize in taking care of, patients also need sometimes endoscopies, which are specialized with an ultrasound probe at the tip, and we call it an endoscopic ultrasound. Between CAT scans, MRIs, and EUSs, we're able to accurately diagnose cancers and identify the stage. And if it is early enough, patients are candidates for surgery.
All right, doctor, how is robotic surgery beneficial for patients?
So we've come a long way. So traditionally, cancer surgery used to be done in an open surgical fashion where patients would have an incision running from the top to the bottom of their abdomen. We still do that in certain cases, but now with robotic surgery, we're able to do the same operations through small incisions. And those incisions are sometimes as small as the tip of my finger. It really allows patients to recover faster. They have smaller incisions, they have less pain. Data has shown that they have less blood loss. Surgery can sometimes be more accurate because of the magnification you get while doing these operations. They also recover quicker. They stay in the hospital for a significantly fewer number of days. And then afterwards, long term, they have better cosmetic outcomes and fewer side effects long term.
It really is amazing, the difference. All right, doctor, for people who might not understand, can you describe basically how robotic surgery works?
So robotic surgery is performed with the aid of what we call a surgical robot. So it's performed completely by the surgeon himself or herself. And the incisions are small, like the traditional laparoscopic surgical instruments. However, the advantage of these surgical instruments with the robot is at the end of these instruments, you have these small little, what we call articulating instruments. So basically, they have like a wrist at the end of it. So it allows us to perform surgery more accurately and more deliberately. And so you have the patient on the bed with the robot docked on top of them. All that is set up by the surgeon. And then the surgeon sits on what's called a robotic console. If you could imagine a small video game console, and we sit into that, we look into it, and we completely control all those four arms of the surgical robot and perform the operation while having an assistant at the bedside at all times.
All right, and doctor, final question. We don't have a lot of time, but what types of cancers are seeing good outcomes because of this technology?
Across the board, all sorts of cancers. I specialize, as I said, in the gastrointestinal tract, from esophagus to stomach to liver, pancreas, small intestine, colon, rectum. I should say that my personal data, especially with liver and pancreas, which I specialize in, patients recover half as faster than they would traditional open surgery, and but you have to be a candidate for surgery.
How quick is the recovery? Just in maybe 10 seconds, doctor.
2 to 3 weeks, and you're back to baseline.
All right.
Typically.
Dr. Iman Siddiqui, thank you so much. Great information on robotic surgery. We appreciate your time.
You're welcome. Thank you for having me.